Hello everyone. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. And before we start, we would thank Universe for giving us this great opportunity with Gayatri Mantra chanted by Professor Regina from Brazil. Would you like to chant Professor Regina, please?
Thank you very much. Om Bhuvat Swaha Tat Savitur Varenyan Bargo Devasya Dhimahi Dhiyo Yona Prachodaya. Many blessings to the universe. Thank you.
Thank you. And welcome to Ka Homeopathy Study Group Pro Bono webinar hosted by Kavita Holistic Approach. I would like to take privilege to say that our Ka study group is very unique Homeopathy Pro Bono study group from the United States of America, which formed to unite world-renowned practitioners throughout the globe. Ka's mission and vision are very unique to inspire young homeopaths. Mentor, provide excellence for educational purposes using holistic approaches via webinars, which provide professional continuing educational homeopathic credits for practitioners. We follow the principles of classical homeopathy and invite speakers for HNI accredited webinars. We value and treasure the human collective as our honorable peers. We provide merit certificates for spreading the light of homeopathy worldwide while celebrating stage 4 cancer survivors through our inspirational book talks. These webinars for educational purposes only and see an expert homeopath for treatment. This is Kavita Kokunur, board certified homeopath from Michigan, USA, President and CEO of Kavita Holistic Approach, founder and director of Ka Homeopathy Study Group. I'm outreach coordinator of CHC PR committee, encouraging homeopaths to become CHC certified. As HNI CPD provider, encourages homeopaths for HNI accredited webinars. I'm member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. I sincerely thank Ka Homeopathy Study Group entire team for their continuous support. This webinar is moderated by Ka family, Dr. Sweta Singh, Chief Administrator, and Professor Regina Rianelli. It is being recorded as we speak and we are live on Facebook. Today, March 21st, 2021, and we have two honorable speakers. Today's webinar topic is Homeopathy in Pathological Conditions by Dr. Sanjay Modi. And at the end of the webinar, we have Executive Director Holly Manogian speaks about homeopaths without borders. So please stay tuned until the end of the webinar. Let us welcome our first honorable speaker, Dr. Sanjay Modi. He is a homeopath based in Mumbai and is attached to CMP Homeopathic Medical College since 1985, with an experience of more than 35 years in practice and teaching homeopathy. He is known for giving rapid results, difficult advanced pathological diseases with homeopathic medicines. He has authored two books, Organ of Medicine and Accurate Homeopathy. Dr. Sanjay Modi, in last 12 months, has given a series of webinars on COVID treatment. His specialty is how to differentiate between remedies and to select the accurate similarium in each case. His page Definitive Homeopathy on Facebook has all the links and information. He has given several seminars and several workshops. And let us welcome our first honorable speaker, Dr. Sanjay Modi, to our webinar. Yeah, please unmute.
Thank you, Kavita, and thank you all for having me here. It's a pleasure to address such an august audience here, and I definitely appreciate the efforts that you have been putting in, to upgrade and update homeopaths all over the world. So that itself is very creditable. So let's start off today. So today we are going to address this topic on homeopathy and pathological cases. Before we begin that, are you able to see my screen, share screen?
Yes, sir.
Yeah, good. Okay. So today we are going to have two speakers. One is going to be me and the other is going to be Holly. And she's going to talk on homeopaths without borders. So let's get settled. Everyone, keeps saying that homeopathy is a wonderful science. And I have no doubt about it. But the question comes to my mind as to why has this system not been able to gather the fan following, respect, success it truly deserves. Why is this science far away from the potential it's capable of achieving? So, I have been in the field for last 35 years and I have been witnessing a lot of ups and downs about the system. And one of the questions that, that had been bothering me for over a period of time is this, that why does homeopathy not get its fair due when we all know that the system is a very wonderful science? So, when looking to that question, one of the main reason that I found was that there happens to be a confusion about the application of homeopathy. From case taking to case processing to remedy selection to the potency and repetition of medicine, we encounter number of pathways. You all will agree that there are a lot of pathways that each one follows, and there are no guidelines for any of these steps so as to ensure uniform outputs. Hence, every practitioner finds himself lost in a maze in which he constructs his own game. Each of us has many blueprints about all these steps in our mind. We interpret everything we experience through these mental maps. So we have all been given ready-made blueprints and we all work out of those blueprints about what needs to be done when selecting a remedy. But we seldom question their accuracy. And that's a big issue because we never question the accuracy of the blueprint that we carry in our mind. We are usually unaware that we have them. We simply assume that the way we see things is the way they really are or the way they should be. And our attitudes and behavior grow out of these assumptions. The way we see things is the source of the way we think and the way we act. So all our actions, our attitudes, behavior are all guided by the blueprints that we have been carrying around. Sad to say, but a patient is like an elephant in the story of the six blind man and elephant. I think you all are aware about this wonderful fable story, Each one feels that his or her assessment and interpretation is the most correct one. And this has given rise to many school of thoughts in homeopathy, thus furthering the confusion and the conflict in the minds of practitioners and students alike. The question that comes is there a way which encompasses all ways? So just a photograph to make you aware about that every one of us is feeling a part of the elephant and we feel that that's what is the elephant about and we all know what an elephant is. So the $1,000,000 question is what do we do about it? My suggestion is reinforce yourself with facts which take you to the right knowledge. One of the important points which Hahnemann has always talked about is, unprejudiced. So science and unprejudiced have a very deep connection, is what I understand. First step in being scientific is to become unprejudiced. That is why Hahnemann has always wanted a homeopath to be an unprejudiced observer. Now, if I say or ask you a question that is homeopathic scientific and why, most of you will answer yes, it is scientific. Because whenever I ask this question, everybody says that yes, we have a scientific law to back our understanding, and that is why we are scientific. Just having a scientific law, the law of similars, is not sufficient for it to make it a science. Is what I understand. So what is it that I understand out of science? So what role does the science play in our day-to-day life? If I ask you a question, that what is the role that science plays in our day-to-day life? The answer would be that there is firstly an ease of application. It's like, electricity is a science, but how do we use an electricity? If you want to on a fan, it's a button there and you on it off, and you are with the fan, with the AC, with all the electronic appliances. So the use of a science is that it has to have an ease of application. Therefore, even when somebody is not 100% conversant to the technology of the product that is to be used, he or she can still efficiently use 60 to 70% of the system. Do you all agree on this particular thing? That we don't know what actually is in making of a mobile, but we all can use mobile very well to its optimum capacity. And the second part that I feel science should have is uniformity. For instance, anyone who follows a set of procedure or a protocol would always come to the similar outcome within a reasonable range of tolerance. If I on a switch and it ons the fan, anyone who does that should have also the similar result, is what I feel a science is like. So, ease of application and uniformity is what are the 2 points that make up a science. And if I ask you a question again, that is this what you feel about our system? And I know the answer because I receive a lot of answers and all of them say no. The question that we need to ask is why? Why is it that we do not feel the same about our system? What we need to look into is this, that are we prejudiced? There are some of the reviews on the book that I have written, by the name of Accurate Homeopathy. And I'll put in, this is the cover page of the book, Accurate Homeopathy, Hahnemann's directives and its application, where, I have put across the law of potency selection and repetition and trio for totality of symptoms. These are my, understanding of the potency and the totality of symptoms. So what does homeopathy design says? Homeopathy design says that I feel enlightened and have reached a deeper awareness of various philosophical and clinical aspects. Some new to me, some reinforcing my experience, and some nudging me into a deeper thought into the art and science of homeopathic practice. There's a journal by the name of Homeopathic Clinical Case Recorder, which says that I must confess that in my 70 years of homeopathic practice, more than 40 years of homeopathic reading and practice, I have never come across such a book. I am grateful for the many new ideas that I have imbibed. National Journal of Homeopathy says I always welcome an encounter with a homeopathic book like that of Dr. Sanjay Modi, aptly named Accurate Homeopathy, which represents pure essence of how to select the right remedy. And HomeoLinks gives a superb review when they say that Dr. Modi's map works superbly when it comes to those aspects in homeopathy which cause no end of confusion in the minds of current students and practitioners. The chapter on representative, that is Dr. Modi's term for characteristic, is particularly useful in that it reveals our prejudices and confusions concerning pathognomic symptoms. Regarding reading Dr. Modi on the impure sources of disease and materia medica, one is left to wonder how the genuine practice and teaching of homeopathy could be turned on its head within the space of less than 150 years. And I feel that this is a beautiful chapter which everyone, that's why Link says that this chapter is an essential reading for anyone who is concerned with the integrity of homeopathy, because you will be amazed to see a shift that has happened around what is written. It's absolutely turned on its head. What we were told and what we are doing does not match around. So Homeolink says that anyone who dares to know and likes to have his own homeopathic prejudices challenged should read this book. It will undoubtedly set on the right path all who sincerely want to gain clarity in homeopathy. And I invite you to probably take a look at the book and see for yourself as to what is the difference that I have been talking about. Because based on that, we have started a group by the name of Definitive Homeopathy, which we can have. You can join us at the WhatsApp group or the Facebook link, which are all given here, because we ensure imparting the knowledge from the basics. And email ID would be healingtao@gmail.com. So if there are any queries, any questions you want to ask me or address, you can just mail me up at the healingtao@gmail.com. Lastly, I just want to tell you that life does not get better by chance. It gets better by change. And what Hahnemann says is still applicable to me, to us also. Dare to be wise. So today we are going to look to cases, which are pathological, and they are going to question the blueprints that we all have been carrying around, in our minds. And let's start with one of the case of, let's say, pneumonia. So, are you able to see this slide?
Not yet, doctor.
Not yet. Okay, okay.
Please press share screen again.
I did that again. It's not coming up. Okay.
Wonderful.
Now you're able to see that? Yeah, okay. So this is a case of pneumonia. Thank you, Regina. Of a lady who is 40 years, and the patient had gone to a hill station, Mahabaleshwar. And there was a chilled weather there, had alcohol with ice. There is a lot of strawberries that grow around. So there is, it's famous for strawberries with ice cream. So she had a lot of strawberries with ice cream. There was a lot of walking around. And she started with cough, which was painful. She developed fever, which was around.
Sir, we can't see the screen, sir. I'm sorry to interrupt.
You're not able to see the screen. Your screen is shared around. I think you need to. Are the rest able to?
There is another message. Oh, yes. Now, okay.
Now it's okay?
Now, okay, sir. We are able to see.
Okay.
Absolutely.
So she developed fever of around 102 to 103 with chills, and felt cold, cannot bear, fan or AC. And this chill started in the evening and continues all night, not relieved by external warmth. And fever was around 102, which is aggravated 5 p.m. onwards. Morning, the temperature goes down to around 99 to 100. She had cough with rattle in chest pain while coughing. breathlessness with cough, wheezing, worse night, lying down, better sitting up, body pain, feels restless, keeps tossing and turning with pain, weakness. Chill is followed by heat with thirst, restlessness during chill. So you have all the clear features of, a cough with chills, and the chills is, having the heat, sweats, and thirst stage. And the personal history was, she was a known case of asthma, and mother was also an asthmatic with the pulmonary coughs 3 times. So there was the family history. She had craving for ice creams, cold things, and you saw the outcome. Because of that only, she landed up into pneumonia. She had aversion to milk, brinjal. Thirst was around 10 glasses of water. Otherwise, on a regular basis, perspiration was not much, and she was an obese lady. Mentally, she had anxiety if the children would get late, would get angry and she would ask them to call up if they are late. Gets all negative thoughts, for example, of accidents and all. Very responsible towards family members. Confidence, one of self. So there is a need for one of self-confidence for the first time, but after 2 or 3 meetings, has no issues. Short-tempered if things don't go according to her wish. And if her ego is hurt, will not forget it, dwells on it for long. So we have a lady who is, worried, anxious about children, especially if they are late, and she also cannot forget, things which have hurt her. Menses are 2 to 4 days regular, lasting 28 days. They come after an interval of 28 days, and they last for around 2 to 4 days. Scanty flow as compared to before a year, and there are no complaints before, during, or after menses. So that's the X-ray, which was taken on 13, 12, 16, and the report says that there is a patchy shadow seen in both the mid zones. The rest of the lung fields are clear, and opinion says that patchy shadows are seen in both mid zones due to infective etiology. And she's advised follow-up after antibiotics to rule out pulmonary coughs. So if the shadows persist, then she should rule out pulmonary coughs. And you already have the mother having a history of pulmonary coughs. So we started homeopathic treatment based on the symptomatology that the patient has given us, and we took up the totality of ailments from cold weather, ailments from ice cream, ailments from ice drink, ailments from physical exertion, restlessness chill during, restlessness changing place, fever, evening lasting all night. And on repertorization, we find 2 remedies come very close by, rustox and arsenic. Now, I always say that a good repertorization totality will always have 2 remedies which are very close, neck to neck, difficult to differentiate. That would be a good repertorization thing. So, we need to differentiate between arsenic and rustox. And we find that there are a lot of similarities between both the remedies. One can definitely mistake one for the other, because there is restlessness in both arsenic and rustox. Both are good for influenza. Both have dryness of mouth with intense thirst. There is great apprehension at night in both the remedies. They cannot remain in bed because of the restlessness in both the remedies. Right-sided is more effective than left-sided. Water tastes bitter in arsenic, whereas bread tastes bitter in arsenic. So there is still a bitter taste in the mouth, and cold drinks aggravates, ices aggravate, cold and damp aggravation is found in both the remedies. So we have remedies which come very close by in all the, from aggravations to mentals to physical generals. And, if we need to go a little deeper, we find that aggravations are generally arsenic has midnight after 2 a.m. aggravation, whereas rustox has an aggravation of getting wet and the complaint starting. The tongue is very characteristic. Arsenic has dry, clean, and red, whereas rustox is a diagonal coating with imprint of the teeth or a red triangular tip. Classically, if it is a Rustock case, you can have a red triangular tip. The cough symptoms also have a very differentiating point. Arsenic has darting pain through the upper third of the right lung. So very characteristic is the upper third of the right lung, where it's the location of arsenic, whereas Rustock's has dry cough before and during the chill, and cough which is very painful more at night. Mental's arsenic has great fear, anxiety and worry, fear of death, despair of recovery, exacting, fastidious. Rustock's dwells on unpleasant events, anxiety about children, dullness, confusion of mind, satiety of life, and desire to die without sadness. Generalities, Arsalb is extremely chilly, wants to be wrapped up warmly, hugs the fire, chilly with rheumatic complaints, warm-blooded in headaches. There is great frustration with rapid sinking of the vital forces. Out of proportion is what we talk of, the rest of the illness. So maybe a day or two of fever and she has tremendous amount of prostration. So, it doesn't come after 10, 15 days of fever that the prostration comes around. It's unlikely to be arsenic. Burning pains are there of the affected parts. They burn like fire. Pains maddening, even felt during sleep, causes shortness of breath. So burning pains that cause shortness of breath. And characteristic this burning is better by heat, hot drinks, hot application. This is a hallmark feature of arsenic. We all know. So all complaints in Rustocks are brought about by exposure to cold, damp weather, getting wet. There is great rigidity, stiffness, numbness, and pain are experienced in the first motion or after the rest, better by walking or continued motion. So first motion or rest aggravates, and walking or continued motion ameliorates. Most of the complaints are relieved by movement and aggravation by rest. Aggravated at night and in damp, rainy weather, better by heat in general, covering the body warm application, etc. ameliorates. So both are ameliorated by heat, and we have distinguishing features in terms of that there is arsenic which has restlessness of the mind and the body, whereas Rustock's is restless body. And we have another remedy, that's aconite, which is only restless in the mind level. And here we find that the restlessness is more at the bodily level, and the cough, which is very painful, worse at night time. So we started with Rustock's 1 mQds for 7 days. On 21/12, the cough and the fever were better. Restlessness was there, reduced by plus, and there was occasion on examination Krebs plus, which also had reduced. So we continued for 4 more days. On 25/12, fever was 0, no cough, restlessness was much better. On an examination, respiratory system showed nothing abnormal. So Phytum was given for 15 days. And then we did an X-ray, and the X-ray says on comparison with the previous X-ray, there is seen complete regression in the bilateral middle zone lung lesion. So you find that there is a complete resolution of the problem. And where's the slide? I don't know. Okay. We did have the X-ray of post X-ray also. Unfortunately, it's missing out here on this. So acute diseases, so what's the learning that we get out of this case? That acute diseases requires an in-depth clarity of knowledge of disease and the knowledge of medicine on the part of treating physician. Because I feel acute diseases are, a gold mine as far as proving homeopathic action is concerned. And if we take the right step in treating acute diseases, homeopathy will definitely have a lot to give to the world. It is important for a homeopath to know the differences of remedies in all sphere of action. I always say that you need to understand the remedy at all the levels so as to avoid prescription errors. If only we take one sector and we just try to compare the remedies in those sectors, then there's a possibility that we can land up into a prescription error. because that steals time and gives a wrong impression to the patient that homeopathy is slow acting. And we already have this, thought which goes around in people's mind that homeopathy takes time to work. I am absolutely against this statement. In fact, I have a dictum in my practice that, you delay a cure and you have denied a cure. So I always believe that Hahnemann's second aphorism, we'll see later it also, that rapid cures are the important aspects of homeopathic prescription. So that's case one. If you have any queries or a question, you can address to me by the end of the session. We'll take it at the end of the session. Good enough?
Yes, sir.
So yeah, let's start with another case. So are you able to view the slide?
Yes, sir.
Hello. Okay. Okay. So, we have a case of kind of right ureteric calculus with hydroureter and hydronephrosis. So this is a beautiful case that teaches a lot, to homeopath. And this is a case of a 20-year-old male who reported on 14th August 2002. So now it's more than around 18 years that have passed by for the following complaints. That pain in the right lumbar region since May 2002. So he had this pain in the right lumbar region in May, and it's a colicky type of pain, and there is vomiting prior to the colicky pain, and pains are worse from exertion. He also complained of flatulence, sensations of distension of abdomen, and he was on the following treatment, that is flavoxate once daily and Lasix. Why is because we have a past history. He already had, he had been admitted in May and July 2002. See, he came to us in August, remember, and in May, from May he's been having this pain, and he had 2 episodes of acute renal colic where he was admitted, and he had been put on IV fluids, antispasmodics and diuretics. So when he came to us, that was the 3rd episode. So, USG on May shows a 6.3 mm right ureter calculus with mild right hydronephrosis and hydroureter, which was treated. Then there is a USG in July, which also again showed a 6.2 mm right ureter calculus with right hydronephrosis and right hydroureter. So there were 2 episodes which were treated with, IV fluids, antispasmodics and diuretics. Now this is the USG, of the first time, that's the May one. And I'll just refer to the impression that is said around, which says that mild hydronephrosis and hydroureter is noted in the right side. The right ureter shows a calculus in proximal portion. So that was the first May USG. Then we have the July one, which says again that there is a right kidney shows mild hydronephrosis, hydroureter, a calculus seen at the right vesicoureteric junction. So that also was treated homeopathically, and he came to us in August with a 3rd episode. And other features were sweats more on the upper half of the body, staining yellow. Thermally, the patient was hot. The life situation is studying in final year engineering, mild, gentle natured guy. He becomes anxious before exams and is worried about his performance. I thought this case to be very simple, straight, easy to handle, and I was so confident about it. So I took up anxiety before exams, right-sided calculus, guesses, distension of abdomen, hot patient. And the remedy that came up was very clear to me. It was lycopodium, and this is the August sonography, which says that the right kidney shows mild hydronephrosis and hydroureter, and calculus is seen at the right vesico-ureteric junction, and the size of the calculus was 5 mm. So at that time in August, I find that he is having a third stone, which is of a 5 mm in size. And with lycopodium, I thought that things would set perfect. So, we started with, that's the USG. On 14/8, we started the treatment with the stone of 5 mm, and lycopodium was given 30 TDS. Now, after 2 weeks, the patient comes and says he's better. So we told him, you stop your Lasix and flavoxoid because that's not going to help much. We still continued on 11/9. Again, he said, I'm much better. I have no complaints. So we still thought that, okay, let's continue. So we continued with the medication. And, after a month, so that is on 4/10, we again asked him to do sonography because he was showing no complaints and he was feeling better. So I said, let's do a sonography. And to our surprise, we find that, the calculus measures around 5.8 mm. So in a month's time, instead of 5 mm, it became a 5.8 mm stone. And then there was again mild hydronephrosis and hydroureter. So what do? Do we continue lycopodium? I don't do that, okay? Because I feel that if the remedy was right enough, it should have helped him in this particular course of time. And a stone going from 5 to 5.8 mm itself shows that the disease process has not been under control with the medication that we thought that helped him. So, we took up features. So on October, 16th of October, when he came with the sonographic report which shows a 5.8 mm stone, we took up the features again. So we asked him, what about the pain? Tell about the pain. So he said the pain is on the right side, which is worse generally around 8 to 10 a.m. and also worse after sleeping, aggravated sitting, which is better by urination, better by vomiting, better by walking, and there is a hematuria in urine, and he is very restless with pain. So, what we did is we took up those features, and we took up those features for the rubrics, and we said kidney pains, ureters right side, kidney pain morning, kidney pain urination after amelioration, kidneys pain sitting aggravates, and urine blooding. And we find 2-3 remedies coming very close by. One is tarantula, the other is lycopodium, and the third is Berberis vulgaris. Now these are all the remedies that are very useful for stone, but tarantula is not the remedy we expected. It was just out of the blue that tarantula came around. So the best choice would be to give Berberis vulgaris because lycopodium was already given, and Berberis we all know is a very good remedy for renal stones. So we need to differentiate between tarantula and Berberis, and you will be surprised at what homeopathy is. One of the most fantastic science, unbelievable. Because we find that the symptoms of tarantula and Berberis, there are a lot of similarities that come around, Tarantula has symptoms that appear suddenly with violence, rolls on ground from side to side, or kicks vehemently with her feet to relieve distress. Now, this is a symptom, which has been talked around in tarantula, that, with pain, tarantula rolls on the ground from side to side or kicks vehemently with her feet to relieve distress. Now, I have seen in a lot of cases of renal colic, patient literally rolling. Like 2 days back also I had a case of, a renal stone, which is of around 7.5 mm. And the patient was screaming with pain and he was rolling on the ground because, he could not pass urine for maybe around 5 to 6 hours, and he was in a complete distress. Now, when you understand the pathophysiology of the remedy, you understand the condition it's more useful for. So that is why violent pains, neuralgias, as if thousands of needles were pricking, There is extreme restlessness, must keep in constant motion, even though walking aggravates. So even though, they are in pain, they are so restless with the pain because the pain is so intense that they need to do something to get relief of the distress. Barbaris vulgaris has rapid change of symptoms, pain change in regard to their, intensity and character. Pains may be felt all over the body, emanating from a small back. So generally, it's the back pain which moves around in all the parts of the body. All Barbaris pains that radiate not better by pressure, but aggravated standing, exercise, pain radiating from one end to shooting outwards on all sides. These are the type of pains that Barbaris has. Now, the indicatory symptoms of tarantula were bladder tenesmus, cystitis with high fever, dances up and down, music ameliorates right-sidedness. Tarantula is a right-sided remedy, whereas tendency to formation of calculi and lithemia is what is a part of Barbaris. Patient is mentally and physically tired, not inclined to do anything. At the urinary sphere, there is renal pain with prostration. Urination is frequent and painful, which is worse at night. And renal colic in Barbaris vulgaris is left-sided. Pain in the thighs and loins on urinating. So you have tarantula, which is right-sided, and you have Barbaris, which is left-sided. Tarantula also has urine which is hot, thick with gravel-like sediment. And the same about Barbaris vulgaris, the urine is thick, turbid, yellow, red and sandy with slimy sediments. So there is so much of a similarity between tarantula and Barbaris vulgaris. And we never would imagine it, That's what I said, the beauty of homeopathy is when you refer to the Macha Medica, it opens up a very different, vista altogether. And frequent urination, urethra burns when not urinating, cutting and burning in the urethra during and after urinating. So that's Barbaris vulgaris. Mentally, tarantulas are known to be very sensitive to music, suddenly changing moods, fancies, strength, desire for mental work, hurry. Everybody must hurry. They are very cunning and selfish. Whereas Barbaris vulgaris is listless, apathetic, indifferent. Mental labor requiring, thinking is very difficult. The least interruption breaks the train of thought. Melancholy, inclination to weep. So we have in this case, tarantula coming up. Tarantula was right-sided, Barbaris is left-sided. So was prescribed tarantula hispania 30, TDS on 1610. On 2310, the patient says there is no pain, no hematuria, no vomiting. So we continue for 7 days. On 3010, patient comes to us and says he passed on 2310 evening, the time when he came for us for a prescription. He came in the morning and this was evening time when he passed. And the patient did not have any more episode of calculi in the last 18 years. So here you can see what I told you, that this case has a lot of learning to open up and a lot of blueprints that can be broken up. And he already had 2 episodes of calculi, and this is the 3rd episode of calculi. And year after around 18 years still now, he from that day onwards to now, he had not a single episode of this thing. And we have a USG which states that there is no abnormality detected. So we did a sonography again after on 2/12 to reconfirm. So the USC in December shows that there is no evidence of calculus in normal right kidney. Now, what's the learning? The learning is, what I understand is there is a risk of seeing only subjective improvement as cure. Hence, investigation must confirm such improvement. Like what happened in, patient was subjectively feeling all good, but his pathology was not getting all right. So only subjective improvement is not cure. Investigations must confirm such improvement. One of the other things is traditional thought processes restricts the physician from seeing obvious facts. So be open to learning in homeopathy. Tarantula hispania could be thought as an out-of-way prescription in this case, which I differ, okay? But somebody can say, oh, Tarantula, was an out-of-way prescription. I don't think so. Because that's a traditional thought process which restricts us from seeing remedies in, within a particular box. So it also breaks the myth of considering a remedy as superficial and deep, because more than 18 years have passed without any further episode. So, if you probably think on tarantula as a remedy for renal stone, one can say it was an acute prescription. I don't agree on this type of thought processes, because lycopodium, according to our understanding, was chronic constitutional deep acting medicine. Tarantula is not that deep acting, and here also we didn't have much of the mentals in matching of tarantula, but still we find that the patient is free of repeated, the patient had repeated stone before starting homeopathic treatment, and after a homeopathic treatment he has never had a single episode of renal calculi. So that's the second case. And now we come to the last case. So are you all able to view the slides? Hello?
Yes, sir.
Yeah, okay. So this is a kind of SOL in brain. Also an interesting case of Mrs. MC, who reported with the following complaints since 3 months. So she had a right frontal headache with diplopia. And in sitting position, the headache would extend to the right side of the neck. Pain was continuous. There was a heaviness, which is plus, and she occasionally had episodes of sharp pains. And there were beads of perspiration after sharp pains. So generally it was, a continuous heavy type of pain, but sometimes pains will, just sharp pain will just come around. And with that, there'll be beads of perspiration. So she'll perspire, with the pain that is there. She also had convergent squint of the right eye, which was followed by the convergent squint of the left eye. And generals were, she was a hot patient. There was craving for cold drinks. History of a lot of stress. Husband was very ill. She went through a lot of anxiety and fear about his survival. And the husband's illness lasted over a period of 8 to 10 months. So around 8 to 10 months of, a lot of anxiety and fear that she had to go through because of the husband's illness, where, she was not sure, and doctors also were not sure about whether he'll, survive through this particular illness or not. But after the husband recovered, the patient presented with the above symptoms. So that was the ODP. The ODP is what we talk of, the origin, duration, and the progress of the case. And this was the MRI before treatment, which showed that there is swelling. Now, she was advised for more investigations, but she said, let me first try something else rather than going in for invasive investigations. So we only have the MRI with us. So what do you do? How do you go about with this case of somebody who comes to you with a 3-month-old complaint of frontal headache with diplopia and continuous pain with beads of pain? Thermally, you have a convergent squint of the right eye, and then followed with that of the left eye. So it's definitely pathological, because squints generally are when there is a pathology at the brain level. So hot patient craving cold drinks, and there is this history which at the mental level which the patient is presenting with. So we took up the features: excitement, excitable ailments from aggravates, diplopia, headache with vision, there is diplopia, eyes is having strabismus, the squint that is there, and there is paralysis of the muscles. So these are the features which we took up. And the remedies that came up were gelsemium and agaricus. Now, gelsemium and agaricus have a lot of similarities. When we tend to study the remedies, we come to know that they come so close by. Otherwise, we never would probably understand. We never see them as a part of the same problem. But I was amazed to see that both of them have their action on the brain, spinal cord, muscles, and eyelids. And here we have a pathology which is on the brain, which is on the muscles, and which is on the eyes. So, that's the sphere of action of gelsemium and agaricus. Both have ailments from fright, excitement, sun. So both have that as the ailments from, mind you, ameliorated by continued motion. Agaricus is ameliorated by gentle slow motion. Gelsemium has trembling, twitching of muscles are strong indications, and the same trembling, twitching of the muscles are a strong indication for agaricus too. Both have gradual onset of complaints. So you have an 8 to 10 months of an anxiety phase and a fear phase which lasted, and then landed up with an issue. So a gradual onset. Both have vertigo on walking. Gelsemium is having aversion to company, whether agaricus has an aversion to be touched. And at the mental level, gelsemium and agaricus differ because gelsemium has an utter lack of courage. Anticipation of a new ordeal brings diarrhea, wants to be quiet, desires for light, vanishing of thoughts on mental exertion. Whereas agaricus is the reverse. There is increased cheerfulness, courage, loquacity, but answers no question. There is fearlessness, similar to tarantula. Tarantula also are like that, fearlessness. There is awkwardness, clumsiness. Memory is very active. Gelsemium has vanishing of thoughts. Agaricus has a very active memory. And occupation ameliorates in agaricus. Whereas mental exertion causes, there's a dullness, dizziness type of a feeling which is there in gelsemium. So physically there is thirstlessness, dullness, dizziness, drowsiness, eyes or visual effects, and polyuria is gelsemium. Whereas agaricus is thirsty all the time. So here we have, one remedy which is thirsty, the other is thirstless. There is irregular, uncertain, and exaggerated motions. So they are very good for, convulsions and even, spasms. So agaricus is a good remedy because where we have, irregular, uncertain, and exaggerated motion. So we started with gelsemium on 18/4, and on 23/5 the patient is better, headache is much better, vision is improving. So she's coming out of her diplopia. Squint was SQ. So we still continued with her on gelsemium. Now we have a long follow-up of this case. So, I'm not going to put the whole follow-up, but I'll tell you what happens around. So on 26, we did an MRI, and that was repeated after 6 weeks, and that showed reduction in swelling. So we saw that, okay, not the symptoms, but even the signs are showing improvement. So we continued with the medication, and MRI after a year was done. Patient has been followed up for more than 2 years. She has been intermittently given gelcimium 1M and 10M to bring about improvement of her squint, but only squint did not improve. So the rest of the symptom patient had become completely better except squint, which failed to show any response. Maybe the muscles have already paralyzed. So we give the patient, and there was a minimal squint. So she had improved with the squint, but it has not progressed to normal. So the squint was still there. So the patient was given an option to get operated at the end of 2 years, but she refused as all her other symptoms had improved, and this was only going to help her cosmetically, if at all. So it was only from a cosmetic purpose uh, that we had also told that now this is the only option that you have if you cancer. Now the patient has been followed up for 10 years and there has been no relapse. So what's the learning this case gives us? So this was the MRI before treatment, and you can see the red arrow that is there, which shows the swelling. And this was the MRI after treatment, which we did after a year. And the report says that this was done on 13 July 2005, which says that a case of plaque enhancing lesion in the right paracellular region, the right temporal region, and adjacent to the right cavernous sinus on follow-up shows, when compared to the previous MRI dated 1906, there is significant, almost total resolution of the lesion, except for a small enhancing area in the right paracellular region close to the cavernous sinus. So here you find, that there has been a complete or total resolution of the problem. And, you can see this particular thing that the patient is for the last 10 years free of any issues or any complaints as such. So what's the learning? Repetition of high potency in pathological cases will generate rapid results. Because I have repeated gelcimium 1M and 10M in this case, as demanded by Hahnemann in second aphorism. So Hahnemann is very clear in second aphorism that cure has to be rapid. It has to be at the least expense of time, money, suffering, energy on the part of the patient. So it has to be at the least expense of all these things on the part of the patient. Because Hahnemann knew that only a system which can give rapid cure can survive. Because I have written in my book that we are encountering the most impatient species on the planet Earth now. The current generation, whatever we are encountering the most impatient species, and everyone wants instant. Everyone wants an instant. There's instant need for a fame, the instant success, instant there are a lot of instant foods, instant dosa, idli. So there is a lot of instant things which everyone wants to. And I say that even people have gone to the extent of saying that now we can give instant enlightenment. So why not instant cures is what Hahnemann had already predicted so many years back. And that is why he was much ahead of time. I feel Hahnemann was much ahead of his time. And if you probably, understand, read the chapter on, impure sources of materia medica, you'll be amazed at the foresight he had as to what homeopaths are going to do within a span of so much time. And we are exactly doing what Hahnemann has asked us not to do. So he knew that well in advance that this is where homeopaths are going to land up into sooner or later. So rapid cures are one of the important aspects of homeopathic cures, and it is possible with homeopathy. I am very sure about that particular thing. That's why I said I made a dictum that delay a cure and you deny a cure. So the second thing is it is important for a physician to clearly know the facts in every case. See, I always suggest that you be very clear about the facts of the case, because the hard data, that is what facts I am talking of, is the hard data in the case. Any speculation, which I call it as a soft data, will lead to a wrong remedy selection. It is very important for us to know what are the hard data in a case. And if you see all the three cases, they all were based only on a hard data in the case. And that is why I could generate so good result and so fast a result in such pathological cases. And it's not this, I have case of cancer, like, there is a cancer rectum. So there are a lot of cases, which have given beautiful results. So if there are any questions, let's address it here. So are there any questions?
Dr. Sweta, if please, if you find any questions, please can you share?
Yeah, please share it.
Thank you, ma'am. I request the viewers to kindly put their questions in the chat box. And till then, sir, as we are live on Facebook, so we have some questions on Facebook.
Yeah, so wherever
First
they are.
question, yes, it's from Dr. Shrishal. Sir, what is the success rate in acute cases as per your experience through homeopathy?
I'm not talking of only acute cases. I'm talking even of chronic cases. And I have written in my book, actually, if you probably, go through the book very clearly, I have said that, a cure rate has to be more than 70 to 80%. There is nothing shorter than that particular thing that will, revive homeopathy into this world. And I attempt and aim to reach to that particular thing. And I have been able to go successfully in most of my practices, even in acute as well as in chronic, to around 70 to 80%. Yeah.
Next question from Dr. Vidhi, sir. What repertory or software are you using for repertorization?
See, I use Homeopathy, and I always, till now, I always would be using only Ken's repertory. But in Homeopathy, then there is a complete repertory, so I tend to use complete repertory.
Okay, and she's also asking from where we can buy your book.
I have given my email ID, so you can write to me on the email ID with your address, and we'll see to it that it will be dispatched to you. So the email ID is thehealingtower@gmail.com.
Thank you, sir.
Or you can contact Dr. Sweta.
Yes.
So she can direct it to me.
Yes, sure, sir.
Yeah,
Thank
definitely.
you, sir. And one more question is from Dr. Robin Pollock. Would you use 1M in a chronic skin case, or do you start lower to avoid aggravations?
Now, Robin, I have an understanding, that we all are given aggravations as one of the, I feel that there's a lot of fear that has got generated about aggravations. Okay, and I have yet to come across, a case which gets aggravated so worst, frankly speaking. Now, what I am trying to tell you is this, that, there are, some instances which may happen, but, those type of patients are hypersensitive patients, which Hahnemann also says could be an idiosyncratic patient. So in idiosyncratic patients, we can have, aggravations. But my logic says that for those few idiosyncratic patients, why should the rest suffer? Are you getting that? So my logic says that, if at all there are going to be some aggravating cases, which are going to be very few, the rest of the patients should get benefit of rapid cures. So I don't fear aggravation. Because the second thing is that we already know that you can stop the medicines, you antidote the medicines. We have options to, take care of that particular thing. But it should not be at the cost of the rest of the humanity who is going to suffer for a longer period of time. Because Hahnemann says cure has to be rapid. And this he maintains at not one place, but if I, talk on rapidity, I can, give you a lecture on what is the importance of rapid according to Hahnemann, not according to me, according to Hahnemann. because Hahnemann has mentioned this at it's more than 15 places in Organon, the same order of rapid, gentle and permanent. We always talk of gentle and permanent more over rapid. I say no, Hahnemann says it's rapid that is more important than even gentle and permanent. So
That's
does
a
it
great
answer the question?
explanation, sir.
Thank you so much.
That's all about the questions, sir. Thank you so much for
Thank you so much.
this great learning. And for my side, I got this a new learning about tarantula. That was amazing. Thank you. And over to you, Dr. Kavita.
There are some, somebody has put the WhatsApp number if you want to, ask for the book. So
Yes.
Sweta, if you could just repeat the number, please.
Yes, 91908279671 or 919322163102. You can contact these numbers for the book. Thank you.
Professor Regina, would you like to say anything, please?
Oh, yes. Thank you, Dr. Sanjay. It was a wonderful webinar, very contentious, and I learned a lot from you. On the case of the pneumonia, you picked stocks instead of the arsenic album because there were no burning pains, right? Can you explain to me why Rustox? I've been having a client with chronic repetition pneumonia, and it's myoma, and I am very worried she doesn't respond. She's 80 years old, and I wish to help, and you enlighten this case study, which is very important to me. Thank you.
Even we have treated COVID pneumonias also with homeopathy, and we have successfully treated COVID pneumonias. In fact, my session on pneumonia was because we had a lot of cases of COVID pneumonias coming around, and homeopathy has helped beautifully. I'll tell you one thing, it's a wonderful science to be with. And I am personally very grateful to the Almighty for sending me to homeopathy. I really feel that it's a boon and blessing that we can give to the humanity, and the speed and the pace with which we make them better is the best part of homeopathic system. And there are no side effects, and even after effects the patient is very healthy. The moment he is out of the problem, he doesn't have weakness or any post complications, and he just moves out very fast. The transitory phase also is so quick enough that he moves to health very fast, which I see is the best part of our science and our system. So, Regina, I feel that this case also, let's talk on this particular case. If you can give me some features on this part of it, I'll definitely be, helpful on this particular. We can help the patient up. It'll be a pleasure, and let's bring homeopathy up to the level it is expected to be there. That's what I feel. Now, the distinguishing points is what I have already talked about, because the burning pains are a part of arsenic. Yes, very correct. But arsenic has the restlessness at the mind as well as at the body level. Whereas rust tox has restlessness more only at the bodily level. Mentally, the patient is not restless. And if you see in this case, there are a lot of anxiety which the patient has about children. So rust tox has a lot of anxiety about children. Not only that, there is also dwelling on unpleasant events is a part of Rustock's personality more than arsenic personality. So I always feel that we should look to positive points for prescribing rather than negative points for eliminating a remedy. Are you getting to this point, Regina?
Yes, sir. Yes.
Yeah.
Thank you.
Let's look to positive points for prescription rather than negative points for eliminating a remedy. We generally tend to look the other way around, because what I say is this, that there will be other 10 symptoms of rust tox which may not be there in the case. But still, we prescribe on what is available, what is there on the patient. So Restox was selected because the restlessness was at the bodily level more than at the mental level, and also the cough which was painful, which is a part of Restox symptomatology. If we refer to the Materia Medica, it's a very
Night
important
cough.
symptom of night cough, which is very painful, is a part of Restox symptomatology. Does it answer your question?
Yes, it does. Thank you
Okay.
very much.
Thank you. Thank you.
Namaskar.
God bless.
Bless you.
Thank you so much.
Back to you, Dr. Kavita.
Yeah, Kavita, we are waiting.
Yes. Thank you so much, Dr. Modi, for sharing this valuable information, especially on the several pathological conditions with the clinical evidence showing the efficacy of homeopathy. And the cases which you have picked up are the chronic and with especially the differential diagnosis of the remedies as like tarantula and beriberi and Gelsemium agaricus. It is very helpful. Sometimes like we learn many new things. And also your unique way of definitive homeopathy is a great learning for us. So if anyone has any questions, please feel free
Yeah, please
to.
feel to put up.
Yes, we will take 1 or 2 questions and then we welcome our second speaker, Holy Manokian, who speaks about homeopaths without borders. So, and who are watching on the Zoom, please fill the jot form, which is posted by our chief administrator. And if you are watching on Facebook Live, you can email us at caststudygroup@gmail.com and we can send you the jot form. And this certificate is applicable to only who are watching live, either on the Facebook or on the Zoom platform. Thank you so much. And so, are we good, Dr. Modi? Do you have any questions to share?
If there are any questions, I'm willing for this. Thank you so much to all of you. God bless you. And I really appreciate the efforts that you have been putting in. So God bless you for that too.
Thank you so much, Dr. Modi. And we would like to take privilege to honor your precious time in sharing knowledge at our study group today with our CAST certificate. And Dr. Sweta will share. Please kindly accept it from our team.
Thank you so much. Thank you, Kavita, and all of you for giving me a patient hearing.
Thank you so much, sir.
Cheers.
Cheers. Yeah.
Dr. Sweta? Okay, thank you. Hello, everyone. Let us welcome our honorable speaker, Holy Manokian. Holy Manokian is a nationally certified in classical homeopathy through the Council